And thank you for the rare privilege and opportunity to give this brief talk on medication adherence and formulations for the elderly. Adherence is simply patients taking their medications, the right drug at the right time, the right quantity, the right duration, and all of the rights that are associated with drugs. And so non-adherence now is not taking the medications as prescribed. Now, because we are focused on the elderly, non-adherence is a very big problem among the elderly because they are aging. Some of them have problems with cognition. They are unable to remember the dosage sometimes. They can't even remember the counsel that was given to them. Then other times, for fear of many medications. Sometimes patients do not take their drugs also because they are bored. Most patients have been using medications for a very long time because once you get to 60 years, it's most likely that you have one or more chronic disease that will require 1, 2, or 3 medications. So sometimes patients get bored taking their medications. It's a normal thing and it's a problem that is common among the elderly especially. Sometimes also difficulty in swallowing. Because of the aging process, their anatomy of the throat and all of that is changing and they have difficulty swallowing. Other times, cost. The cost of the medication can make a patient not to use the drug as prescribed. So I would want to take us through some things that the pharmacist can do for us, and especially the older people, to help them adhere more to their medications. Because the medication is one key intervention to improving the health of people generally and the elderly in particular. So the pharmacy is the primary healthcare professional that helps us to optimize the use of drugs so that we can have the best outcome from our medication use. And so when medications are not used appropriately or are not adhered to, we do not have the best outcome and the patient tend to suffer from that illness and not improve. So first of all, the pharmacist can assess if a patient is adhering to his medication, and we can probe further to find out why, if there is a non-adherence issue. And we do things like cognitive behavioral therapy. By that, we try to motivate patients to find reasons why they should continue taking their drugs. First, they have to understand the nitty-gritty of how serious their condition is, and to know that these medications are here to help them, and if they do not take the medications, they are going to get worse. So some patients do not have that understanding, and driving the patient to have that understanding helps them to cooperate more to taking their medications and wanting to feel better and get better. So that's one of the things that the pharmacists do for you. And also, when patients do not take their medication, sometimes genuinely they do not understand how to use these drugs. Sometimes you explain to some patients, they nod, but they actually do not understand. That's why most times, especially for the elderly, we seek that. Thank you. So most times we seek that they'll come with a caregiver who is most times available for the use of the drugs, so that whatever the patient in question doesn't pick, the caregiver is there to, complement. So that's what we do for our patients. We do pill counting. Most times when they come for visits, we check their medications, and sometimes you find that a patient is supposed to have exhausted a 1 month medication, and you still find substantial number of drugs. That's an obvious sign that that patient is not adhering as it should. So at that point, we don't just go ahead to give them more medication. We talk to them and ask them genuinely, and some of them open up to tell you, oh, I'm just tired of using these drugs. When shall this stop? You know, so we get to motivate them to see reasons why they should keep taking these medications. Sometimes we help them with aids, like the pill box, that the medications for 1 week or 1 month as a baby can be dispensed and they can easily use it. For even blind patients, they are blind patients because we preach enabling our patients to be able to help themselves. So even when their caregivers are not there, in quote, they are not incapacitated and they are able to do what they're able to do to take care of themselves, self-care. So that's part of what we do. Now, because we know that swallowing for the elderly sometimes is a problem, there are dosage forms, that is the form in which the tablet or the medication is presented to aid easy swallowing. For some patients, they are not able to take tablets or capsules. So we do what we call extemporaneous preparations, that is preparations that you prepare immediately for use within 24 hours or for a week or more while being stored in the fridge, as the case may be. So we have such provisions. Pharmacists can make extemporaneous preparations, and it's important that you consult a pharmacist before you do this. You find some patients just get medications and crush it. It's not every kind of drug that you can crush. There are some drugs that are meant to be taken whole. There are some drugs that can be divided into two. There are some drugs by reason of their, what we call pharmacokinetic property of the drugs. So it's always important that for any of your healthcare needs, the pharmacist is one of the most accessible professionals around you. I'm sure if you look all around, whether you are admitted here or you are in your homes, there are what we call community pharmacies, the pharmacy stores you find around. You can walk into any pharmacy, and drug information is something the pharmacist is very generous with. So you can get drug information from any pharmacy around you at no cost. So I advise for the elderly ones, and for every one of us, because we either have parents, aunties, uncles, and we ourselves, we're learning how to, take care of ourselves when we get there. So medications are really sensitive, and like our professor has rightly said, there is no drug that is without a side effect. So especially for the elderly, because you have many drugs that you take, there are drugs that you don't combine with others, and when you consult with the pharmacist, you'll be able to know what you can take and what you cannot take depending on the medications that you're on. So the last word I want to leave with you is, for any of your medication concerns, the pharmacist is always available, accessible, and reachable by every one of us. I'm here, and any other of our colleagues are available in the community, in the hospital, all around. So always consult with your pharmacist for any concerns about your medications. Thank you so very much. God bless.
Thank you very much, Ma.